And number 3, now we have to start identifying who is actually in front of you. This is based off a Harvard study, so you have to think of a quadrant. There are 4 personality types that are going to be dominant. Sometimes people have their foot in multiple, sometimes it's 2. It's never just going to be 1, but they will have a dominant one. Number 1, we're going to look at a controller. These people are likely your CEO types, your entrepreneur, your fast movers. They're not relationship oriented, they're task oriented. They don't care to get to know about the bottom up understanding of things. They want to know can you get it done? How long does it take to get it done? How much does it cost? What do they need to do? Okay, great, boom, boom, boom. I'll see you later. If you try to overly educate these people or make it about them being able to serve better or go actually have a social life without having headaches, you're gonna be missing. They're gonna care about performance and they're gonna be short, dry, cut, to the point. Just deliver the message, deliver what you wanna do and how you're gonna help them best and send them on their way. They will respect it over time more and actually build more trust that way because they feel seen and understood in their communication style. Number 2, you're gonna have your analyst. An analyst is also task-oriented. They're not relationship-oriented, but these are more like your lawyers or engineers. They love understanding. They love lists. These are the people that make lists themselves and check it off and they get an intense amount of dopamine. It actually brings pleasure to their body. So they love to understand what's going on. They probably want to learn what the disc is and how nerve entrapment happens and how the biochemistry actually changes over time and how organs affected and how the emotions affected. They likely want to learn that stuff for their understanding, but not really for them showing up as a higher level of service for other people or being able to go on adventures. These are not adventurous people. They're more likely introverts. And also, with an analyst, they are hypercritical of themselves. So when you are presenting information to them, we want to be direct and also careful, because if you start to pull out flaws in them that they haven't actually vocalized to you, they implode. This is how their psyches actually develop. They're hypercritical. So if you start to pull out things in them or actually call them on stuff before you've built that right amount of trust, 1, they implode, and 2, they probably will not come back. We have your controller, we have your analyst, and now we're down to the bottom tiers. Number 3 is going to be your promoter. These are the loud people. They're boisterous. They're excited to be in the office. They'll likely talk about sex. They'll likely talk about parties. They're all adventure. And likely the reason they're in their office is because their headaches, their low back, their bad ankle is preventing them from doing those things. So if you cater your language toward, hey, when we fix this, you're going to get back to your adventures, then they're going to be on fire, motivated, and they're going to tell all their friends about you. And then number 4, last one, supporter. Relationship-oriented, very relationship-oriented, not task-oriented. They're not really career-focused. They are all about serving the whole. These are the worker bees in society. They love to be of service of all the people around them, their family, their coworkers, anybody they call family, their friends. So if you start to deliver your messaging to them as, hey, you have these migraines, I understand you, I see you. I want to get you to that so you feel like you're showing up as the best mom, or you're able to show up in your job and it not be a distraction for you, or you're able to be a great wife. Like, it's some form of messaging around them serving at a high level. When we cater these messages to how they are, not how we are, how they are, they feel seen, they actually build a higher level of trust and understanding, and they want to come back not just in crisis, but actually for life, because they understand that this is a place where you develop skills to gain more health, not just move away from pain. Doctors, how effective are you from moment to moment acknowledging what kind of patient is in front of you, what personality type, and how do you cater those messages over time? Because that could be upgraded and that can present your value to a larger amount of community, and then you will have the impact that you want and the practice growth you want.